I worked in emergency rooms for over 15 years, and this is not a drill. Every 37 seconds, someone in the United States suffers a heart attack. If you're over 60, your risk doubles compared to younger adults. But here's what keeps cardiologists awake at night. The majority of deaths happen within the first hour, often before the person even reaches a hospital. Why? Because most seniors freeze, panic, or simply don't recognize what's happening until it's too late. In the next few minutes, I'm going to share 5 critical actions that could be the difference between surviving and becoming another statistic. And I promise you, what I reveal at number 3 will shock you because almost nobody knows about it, yet it's saved countless lives. Before we start, let me be absolutely clear about something crucial. Now, I need you to do something for me right now. Hit that subscribe button and turn on notifications. Why? Because the content on this channel is designed specifically for people over 60 who want to take control of their health. Every week, I break down medical information that could save your life or the life of someone you love. Also, drop a comment below telling me your age and where you're watching from. It helps me create better content for you. And honestly, it motivates me to keep making these videos knowing real people are listening. I've spent the last 18 years working in cardiology and emergency medicine. I've treated thousands of heart attack patients, and I can tell you with absolute certainty that the people who survive are the ones who know exactly what to do in those first terrifying moments. The 5 strategies I'm about to share aren't theories or maybe they'll work ideas. These are proven, doctor-recommended actions backed by decades of research and real-world results. So let's dive straight into number 5, and this is the foundation that everything else builds on. Number 5, recognize the warning signs instantly and call for help without hesitation. This might sound obvious, but you'd be stunned by how many people ignore or misinterpret their symptoms. Here's the reality. Heart attacks in people over 60 often present differently than what you see in movies. Yes, some people get that classic crushing chest pain that feels like an elephant sitting on their sternum. But many others, particularly women and older adults, experience what we call atypical presentations. These can include sudden overwhelming fatigue that makes you feel like you can't move, shortness of breath even when you're sitting still, discomfort in your arms, back, neck, jaw, or stomach rather than your chest, unexplained nausea or vomiting that comes out of nowhere, cold sweats that drench your clothing, and lightheadedness or dizziness that won't go away. Here's the critical point. If you experience any combination of these symptoms, especially if they appear suddenly or feel different from anything you've felt before, you must call 911 immediately. Not your daughter who's a nurse, not your neighbor who can drive you, not your primary care doctor's office. Call 911. Why is this so important? Because paramedics begin treatment the moment they walk through your door. They carry medications that can dissolve clots, equipment to stabilize your heart rhythm, and most importantly, they communicate directly with the emergency room so doctors are ready for you the second you arrive. A study published in the Journal of the American Heart Association found that patients who called 911 received treatment an average of 45 minutes faster than those who had someone drive them. In a heart attack, 45 minutes can mean the difference between minor damage and permanent disability or death. I once treated a 72-year-old woman who waited 4 hours because she thought her nausea and back pain were from something she ate for lunch. By the time her husband insisted on bringing her in, she'd suffered severe heart damage that could have been prevented. She told me later, with tears in her eyes, "I just didn't want to bother anyone if it was nothing." Don't let pride or embarrassment kill you. If something feels wrong, make the call. Before I move to number 4, if you're finding this valuable, give this video a thumbs up. It tells the algorithm to show this potentially life-saving information to more people who need it. And remember to subscribe if you haven't already. Number 4. Take aspirin immediately, but only if you're not allergic. Once you've called 911, your next action should be to chew, not swallow. Chew a regular strength aspirin. That's 325 milligrams. If you only have baby aspirin in your house, take 4 of them to reach that same dose. Why aspirin? Because most heart attacks are caused by a blood clot that blocks one of the arteries feeding your heart muscle. Aspirin is a powerful anti-clotting medication that prevents that clot from getting bigger. It keeps blood flowing to at least part of your heart muscle, which can dramatically reduce the amount of permanent damage. The evidence for this is overwhelming. A landmark clinical trial involving over 17,000 patients found that aspirin given during a heart attack reduced the death rate by 23%. 23%. That's almost 1 in 4 people who would have died but survived because of one simple pill. But here's the key detail most people miss. You must chew the aspirin, not swallow it whole. When you chew it, the active ingredient gets absorbed through the tissues in your mouth and your stomach lining within 2 to 3 minutes. If you swallow it whole, it takes 10 to 15 minutes to start working. In a heart attack, those extra minutes matter enormously. Let me tell you about Gerald. a 67-year-old retired teacher who attended one of my health seminars 6 months before he had his heart attack. When he felt that sudden pressure in his chest while watching television one evening, he remembered what I'd taught him. He called 911, then immediately chewed an aspirin while he waited. The cardiologist who treated him said that aspirin kept enough blood flowing to his heart that he walked out of the hospital 4 days later with minimal damage. Gerald's still playing golf twice a week. Now, the important warnings. Do not take aspirin if you're allergic to it, if you have a known bleeding disorder, if you're already on blood thinners unless your doctor has specifically told you to take aspirin in an emergency, or if you've had stomach ulcers that bleed. If any of these apply to you, tell the 911 operator when you call, and they'll guide you on what to do instead. One more thing. Some people think they should take nitroglycerin if they have it prescribed for chest pain. Only do this if your doctor has specifically instructed you to use it for chest pain, and never, ever take nitroglycerin if you've used medications for erectile dysfunction like Viagra, Cialis, or Levitra in the past 48 hours. That combination can cause your blood pressure to drop so dangerously low that you could die. The 911 operator can help you make this decision safely. Aspirin is simple, it's cheap, and it works. Every person over 60 should have a bottle within easy reach. But taking aspirin is just one piece of the puzzle. What you do with your body while you're waiting for help can be just as critical, which brings us to number 3. Drop a comment right now telling me if you keep aspirin readily available in your home. And if you have elderly parents or friends, please share this video with them. It could genuinely save a life. Number 3. Sit down in the recovery position and do not move. This is the strategy that shocks most people because it goes against every instinct you have. When you're having a heart attack, your brain screams at you to do something, to move, to try to shake it off. But movement is one of the most dangerous things you can do. Here's why. During a heart attack, blood flow to your heart muscle is blocked or severely restricted. Your heart is literally starving for oxygen. Any physical activity, even something as simple as walking across the room, increases your heart's demand for oxygen. But since your heart can't get the oxygen it needs, that extra demand causes more heart muscle to die. It's like trying to run a marathon while breathing through a straw. You're just making the damage worse. The science backs this up completely. A study in the European Heart Journal analyzed outcomes for over 8,000 heart attack patients, and found that those who remained still and calm had significantly less heart damage and better long-term survival rates compared to those who continued moving around. So what should you do? Find a comfortable place to sit. A chair with good back support is ideal, or sit on the floor with your back against a wall. You want to be in a semi-upright position, not lying completely flat. Why? Because lying flat can make it harder to breathe and puts extra strain on your heart. Sitting up or reclining at about a 45-degree angle is optimal. Once you're seated, do not get up. Do not try to walk to the bathroom. Do not go looking for your insurance card. Do not try to straighten up the house before the paramedics arrive. I know that last one sounds ridiculous, but I've had patients tell me they were tidying up while having a heart attack because they didn't want the EMTs to think they were messy. Your life is worth more than clean countertops. If you live alone, unlock your front door or tell the 911 operator where you keep a spare key. That way, paramedics can get to you quickly if you lose consciousness. Then stay put in your recovery position and focus on staying calm. I treated a 69-year-old man named Robert who did everything right when he had his heart attack at home. He called 911, chewed his aspirin, sat down in his recliner, and didn't move until the paramedics arrived. His heart attack was severe, but because he minimized the strain on his heart, doctors were able to open the blocked artery with minimal permanent damage. Robert's cardiologist told him flat out that his decision to sit still probably saved his life. Staying still isn't weakness. It's the smartest tactical decision you can make when your heart is under attack. But even while you're sitting still, there's one more thing you can do to help your body survive, and that's number 2. Number 2. Control your breathing to reduce panic and improve oxygen flow. When you're having a heart attack, fear is your enemy. The moment panic sets in, your body releases a massive surge of stress hormones, primarily adrenaline and cortisol. These hormones do terrible things during a heart attack. They increase your heart rate, which means your damaged heart has to work even harder. They spike your blood pressure, which increases the risk of the blocked artery rupturing. And they cause your blood vessels to constrict, which further reduces blood flow to your already oxygen-starved heart. This is where controlled breathing becomes your most powerful weapon. Slow, deliberate breathing does 2 critical things. First, it increases the amount of oxygen that gets into your bloodstream, which helps your brain and your heart stay functional. Second, and this is the part most people don't realize, controlled breathing activates your parasympathetic nervous system. That's the part of your nervous system that calms your body down. It counteracts those stress hormones and helps keep your heart rate and blood pressure from spiking. Research published in the American Journal of Cardiology demonstrated that patients who practice controlled breathing techniques during cardiac events had lower heart rates, better blood pressure stability, and reduced anxiety levels compared to those who panic-breathed or hyperventilated. Here's the specific technique I want you to use if you're ever having a heart attack. Sit in your recovery position. Place one hand on your belly, just below your ribcage. Breathe in slowly through your nose for a count of 4. You should feel your belly push your hand outward. Hold that breath for a count of 2. Then breathe out slowly through your mouth for a count of 6. You can purse your lips like you're blowing out a candle if that helps. That's one complete breath. Repeat this pattern. In for 4, hold for 2, out for 6. Why does the exhale need to be longer than the inhale? Because longer exhales activate that parasympathetic nervous system more effectively. It's like telling your body, we're safe, we can slow down. I remember a 74-year-old woman named Margaret who came into my ER after a heart attack. She told me that when the chest pain hit, she felt overwhelming terror, but she'd learned breathing exercises in a yoga class years before. She focused entirely on her breathing, counting each inhale and exhale, and by the time the ambulance arrived, she was still conscious and relatively calm. Her paramedics told me later they were amazed at how composed she was. Margaret's breathing didn't stop her heart attack, but it kept her stable enough to get to the hospital in good condition. This breathing technique isn't just for heart attacks, by the way. Practice it now, when you're calm and healthy. Do it a few times every day. That way, if you ever need it in an emergency, it'll be automatic. Your body will know what to do even when your mind is panicking. Controlled breathing keeps you alive by keeping you calm. But there's one final action that ties everything together, and it's the most important of all. That's number 1. Before I reveal it, I need you to subscribe to this channel if you haven't already, and hit that notification bell so you never miss videos that could protect your health. Tell me in the comments what your biggest fear is about having a heart attack. Is it the pain? Being alone? Not knowing what to do? Your answers help me create better content for you. Number 1. Stay conscious and communicate with emergency responders. This is the ultimate survival strategy, and it encompasses everything we've talked about so far. Your number 1 goal during a heart attack is to stay conscious and maintain communication with the 911 operator and then with the paramedics when they arrive. Why? Because the moment you lose consciousness, your survival odds plummet. When you're conscious, you can provide critical information. What medications you take, what medical conditions you have, whether you're allergic to anything. This information allows emergency responders to treat you safely and effectively. When you're unconscious, they have to guess, and guessing takes time you don't have. Staying conscious also means you can follow instructions. The 911 operator might tell you to unlock your door, to move to a more accessible location, or to position yourself in a certain way. Paramedics might need you to answer questions, to move your arms or legs, or to help them help you. None of that is possible if you're unconscious. So how do you stay conscious? By doing everything we've already covered. You call 911 immediately, which gets help coming as fast as possible. You take aspirin, which keeps some blood flowing to your brain. You sit still, which reduces your heart's workload and prevents you from collapsing. And you control your breathing, which keeps oxygen flowing to your brain and prevents panic-induced fainting. But here's an additional technique I want you to know. If you feel yourself starting to fade, if your vision starts to narrow or everything starts to feel distant and fuzzy, there's something you can do. Start coughing. Hard, forceful coughs. 1 every 2 to 3 seconds. Why does coughing help? Because when you cough hard, you create pressure in your chest cavity that literally squeezes your heart and forces blood out to your brain and body. It's like manually pumping your heart. This technique is called cough CPR, and while it's not a cure and it's not a substitute for real medical care, it can keep you conscious for a few extra minutes until help arrives. A case study published in the Journal of Emergency Medicine documented a 65-year-old man who used cough CPR to maintain consciousness during a severe heart arrhythmia until paramedics could treat him. The doctors credited his coughing with preventing brain damage from lack of oxygen. The 911 operator can guide you through this if necessary. Just tell them you're starting to feel faint, and they'll give you instructions. Let me share one final story that brings all 5 of these strategies together. A 71-year-old woman named Dorothy was home alone when she felt sudden pressure in her chest and jaw. She immediately recognized it might be a heart attack. She called 911 first, then chewed an aspirin from her kitchen drawer. She sat down in her favorite armchair and focused on breathing slowly and deeply. She stayed on the phone with the operator, answering questions and staying conscious. When paramedics arrived 8 minutes later, she was still alert and able to tell them her medical history. They got her to the hospital, opened her blocked artery, and she was home 5 days later with minimal heart damage. Dorothy did everything right, and it saved her life. That could be you. That could be your parent or your spouse. but only if you know what to do and you act on it without hesitation. Let me give you one final summary. Number 5. Recognize the symptoms and call 911 immediately. Number 4. Chew aspirin if you're not allergic. Number 3. Sit down and stay still. Number 2. Control your breathing. And number 1. Stay conscious and communicate. These 5 actions form a survival chain. Each one increases your odds. Together, they can mean the difference between dying at home and walking out of the hospital with your life intact. Now I want to hear from you. Where are you watching this video from? Do you have aspirin readily available? Have you ever experienced a heart attack or watched someone you love go through one? Share your story in the comments. Your experience could help someone else survive. If this video gave you valuable information, hit that like button and share it with your family and friends. Especially share it with anyone over 60 who lives alone. This information could save their life. Subscribe to this channel for more evidence-based health content designed specifically for people over 60. I post new videos every week covering topics that matter to your health, your independence, and your quality of life. Thank you for watching. Thank you for taking your health seriously. And remember, knowledge is power, especially when it comes to surviving emergencies. Stay safe, stay informed, and I'll see you in the next video. Medical disclaimer. The information in this video is for educational purposes only and does not replace professional medical care. If you believe you're experiencing a heart attack, call emergency services immediately. 911 in the United States, or your local emergency number. Do not wait. Do not watch this video first. Call for help. This content is meant to prepare you in advance, not to guide you during an actual emergency. Always follow your doctor's specific recommendations for your individual health situation. The studies and medical information referenced are cited in the description below for your review. Final disclaimer. Remember, this video is educational. It prepares you for what to do, but it does not replace emergency medical care. If you think you're having a heart attack right now, stop watching and call 911. Don't wait. Your life depends on immediate professional help.